If you go by figures from the Boston Public Health Commission, the strongest warning signs about the COVID-19 infections are coming from East Boston. The rate of positive testing for the virus there is more than 3 times the figure from any other neighborhood. Even before the rates last increased, the problem had the attention of East Boston's state representative, who's joining us. He's our guest, Adrian Madaro. Thank you very much for being with us, Representative.
Thank you, Chris. Pleasure to be here.
Representative, fill in the details a bit more here. What's happening with the figures? This is chiefly the rate of positive testing results for the virus in Eastie. How bad are they and why?
Yes, again, Chris, thank you for having me. So as you stated, East Boston has by far the highest COVID infection rate in the city. When I wrote an op-ed in the Globe, which ran last Friday, the data 2 weeks ago reflected a positivity rate of 7.9%. As of last week, East Boston's positivity rate has shot up to 11.4%, an increase of 3.5% in just 1 week, Chris. And to put that in perspective, the state has a positivity rate of about 1.1%. Overall in Boston, we have a positivity rate of 2.6%. In the city, the second most impacted neighborhood, which is Roslindale, has a positivity rate of 3.5%. So East Boston is clearly an outlier here. 7.9% higher than Roslindale, 8.8% higher than the city average, and 10.3% higher than the state average. Pretty alarming stuff.
Well, there are other neighborhoods in Boston, at least parts of neighborhoods, where you might find a lot of poverty, a lot of multi-generational households, maybe language barriers coming into play, and their rates aren't nearly as high. So what separates East Boston from the rest of that?
That's a great question. And that's something that we've been discussing a lot, Chris. And really, it comes down to the fact that East Boston is simply systematically more vulnerable to the spread of this disease. This was true at the beginning of the pandemic when we, again, had the highest rates in the city. And that's become more so as we progress through the phases of reopening. There are many working class East Boston residents who simply don't have the privilege of working from home like you and I are doing right now. Their jobs, largely in maintenance and service industries like construction and hospitality, require them to go out to work and regularly interact with coworkers and members of the public. Evidence of this could be seen on uncrowded public transit. I mean, during the shutdown, while ridership decreased significantly across the MBTA, the Blue Line ridership remained rather steady. And that is because our folks still had to go to work under circumstances where social distancing is difficult, if not impossible. And Chris, while the shutdown meant that some of these workers were able to stay home, the state's reopening means that even more are back out to work with the public now. And as a result, East Boston residents and surrounding communities have an elevated risk of COVID exposure and infection. And it's also important to note that, some are talking about the correlation of increased testing as the reason for East Boston having the highest rates. Well, we're actually only the third most tested neighborhood. So increased testing alone is not the reason for such a high rate. And thus the rate at which positive tests and percent positive is rising far outstrips the increased rate of testing. Some other factors that are important to note: housing, for example, which you just touched on. Many East Bostonians live in multi-generational apartments or share rentals with multiple roommates. The reality is people share bedrooms in our community. East Boston has by far the highest rates of overcrowding in the city. This is important to note. Density and overcrowding are not the same thing, right? Overcrowding is people per bedroom, likely influenced by our being an immigrant hub, having some of the oldest housing stock in Boston, and more broadly really speaks to our affordability crisis in East Boston. But Chris, the reality is that when everyone is living together in a small space, there just aren't many opportunities to socially distance. And that means when a worker gets sick, they have nowhere to quarantine, putting the rest of their household at a higher risk of contracting COVID-19 and putting the community at risk. This is known as family spread, by the way, and it's one of the main reasons why the coronavirus is spreading so swiftly in East Boston. I think another important factor to note is our status as an environmental justice community. We in East Boston are simply more prone to COVID-19 due to pre-existing health conditions that are the result of long-standing environmental burdens. East Boston is an environmental justice community with a history of air pollution. And when you look at the municipalities with the highest rates of COVID, Everett, Lynn, Chelsea, Revere, they're all environmental justice communities, Chris. And in East Boston, we've long suffered from elevated rates of respiratory illnesses like asthma and COPD, which really is a legacy of our living next to Logan International Airport, major highway, other environmental burdens. And COVID can cause respiratory illness, so it's no surprise that our residents are at an increased risk. And in fact, this was just noted by our Attorney General, Maura Healey, who released a report on the role of environmental pollution and higher rates of COVID infection in low-income communities of color a couple of months ago. So it's simply no coincidence that these communities like East Boston remain the hardest hit now.
Well, one thing I've heard from some of the activists in East Boston, I'm sure you heard it even quite a while ago, was that there's a need to help people with isolation, maybe put somebody up in a hotel room for a while like they did in Chelsea. Is that something that should have happened more often and sooner in East Boston?
Yes, that isolation sites are absolutely critical. And I think that speaks to the difficulty that folks have to socially distance in Eastie and, that family spread that I spoke to where, if you're sharing, if you have multi-generational housing, you're sharing bedrooms, it's just impossible to socially distance and stay safe. Thankfully, there are a number of things in terms of what we need to do now, right? And I think the city and the state are starting to step up, and there have been some positive progress in the past few days. There are now discussions between the city and the state about finding temporary isolation housing so East Boston residents can actually quarantine away from their families if they test positive. And one thing that's certainly worthy of discussion is looking at the state's isolation facility, the hotel in Everett, which is pretty close to East Boston. Perhaps there's an opportunity to reserve some beds at that hotel specific to East Boston residents to address that need. Beyond that, though, there are some other good things happening. For example, I would just say to back up overall, right, we need increased resources and assistance from the state. And I'm grateful that Governor Baker recently set the stage by creating designations for high-risk communities and pledging that additional aid. It's important to note Eastie was not listed as a high-risk community because we continue to get lumped in with the city of Boston's data. And really, East Boston needs to be looked at alone because we're much more akin to the communities designated as high risk, the ones I mentioned before, Chelsea, Revere, Everett, and Lynn. The aid I speak of should really include increased testing and tracing and contact tracing capacity, priority for federal funding, things like more PPE and disinfectant resources, increased and improved public health messaging, and these communications have to be culturally competent, linguistically sensitive, so multiple languages. And it's really critical to your point that we expand access to those isolation sites. But I am happy to report that some of this additional aid has already commenced. We've begun increased testing and contact tracing. The East Boston Neighborhood Health Center, which kudos to them, they have done an incredible job keeping our community safe. Obviously, we're already dealing with really elevated risks, but for the staff at the East Boston Neighborhood Health Center, I'd be very worried about where our community would be today. But they recently started expanding testing and contact tracing, which, by the way, I want to take this opportunity, Chris, to encourage all East Boston residents to get tested. The health center has COVID-19 testing available at multiple locations, including a new one at 164 Orleans Street. Testing is available at no cost to individuals and for anyone, regardless of symptoms, regardless of immigration status. We're trying to make it as accessible as possible, so there are drive-through and walk-up options available on the weekdays and weekends. The only thing to note is that pre-registration for testing is required. All folks need to do is call 617-569-5800 and make an appointment with the health center. Again, 617-569-5800 to make an appointment to get tested. In conversations with the mayor, he reported that he's going to be deploying the city's mobile testing team to East Boston. That'll start September 1st, which will create yet another access point for testing for residents. And the city will also be conducting case investigations and focus groups to help with those contact tracing efforts. Now, on the subject of improved public health messaging and communications in multiple languages, there's also been some positive progress there. The health center is producing over 5,000 care kits to give directly to residents to help mitigate that spread, and we're really going to focus on high congregation areas. The materials will be multilingual, English, Spanish, and Arabic, which are the prevailing languages in East Boston, with information on COVID, on how to get tested. Those care kits will also include protective equipment like masks and hand sanitizer. And to their credit, the city is starting to mobilize teams to provide additional multilingual safety materials and education to residents and businesses. The info will focus on the importance of social distancing, hand hygiene, the importance of avoiding big gatherings, and really explains how to practice safety at home where someone has symptoms or where someone potentially is tested positive. The other thing to note is that there will be a bunch of multilingual signage added in places of congregation, like our parks and our community centers and strip malls to help raise awareness and educate the community about COVID risks and best practices. And we've also engaged now all our faith-based organizations to distribute these educational materials during their weekend services. That started this past weekend and will continue for the foreseeable future.
I know we're talking very much about immediate responses, but mainly in connection with the studies around particulate air pollution. If you look at what's been happening with the pandemic in that study, what about the future? Because we have things in the pipeline for expanding housing supply, expanding the airport, we have transportation challenges. What's the message to that?
We need to approach all of this with caution. We are already very densely populated in East Boston, and that's certainly one contributing factor. Our overcrowded transit, which I mentioned earlier, is another contributing factor. So, I urge caution as we approach this thing on really any domain, Chris, because the principal consideration has to be the safety, the vitality, the well-being of the residents of East Boston, and more broadly, the city and the Commonwealth. Some things that we should be doing on a state level. We really need emergency paid sick leave. That is necessary. The current sick leave system simply was not designed for a pandemic. And right now you're seeing my constituents having to choose between their health and their economic security, which is simply an unfair burden to put on folks. The reality is that many East Boston residents are forced to continue working even if they're exposed to coronavirus because they need to pay those bills. By the way, sick leave is a form of aid that's available to all workers who pay into the system, including undocumented workers, of which there are thousands in my community. And honestly, the state has an obligation to help our most vulnerable residents who have been systematically more exposed to COVID-19 infection.
Well, thank you very much for taking the time to enlighten us on that. East Boston State Representative Adrian Madaro.
Thank you so much, Chris. Stay safe and take care.